Main function of platelets: to transport oxygen, to fight infections, or to stop bleeding. To stop bleeding, and promote blood clotting when a blood vessel is damaged. What is the name of the protein that forms networks for blood clotting? Fibrinogen, hemoglobin, or collagen? Fibrinogen. During blood clotting, fibrinogen is converted into fibrin by the enzyme thrombin, which then forms a network that traps platelets and red blood cells to create a clot. What are the upper chambers of the heart called? Ventricles, septas, atria. The atria, the right and the left atrium, receive incoming blood before it's pumped to the lower chambers, the ventricles. Which valve separates the left atrium from the left ventricle? Mitral, tricuspid, or aortic? Mitral, also called the bicuspid valve. What is the name of the heart's contraction cycle? Myocite, systole, or diastole? Systole. Which blood vessels carry blood from the heart to the organs? Veins, capillaries, or arteries? Arteries. What is the function of the left ventricle? To receive blood from the lungs, to pump blood to the right heart, or to send blood to the whole body? To send blood to the whole body. Which blood vessels return blood to the heart? Capillaries, veins, or arteries? Veins. What structures prevent blood from flowing back in the veins? Muscles, atria, or valves? Valves. Which vein carries blood from the head to the heart? Vena cava, jugular vein, or carotid vein? The vena cava, particularly the upper part called the superior vena cava. Which disease can be caused by high blood pressure, hypotension, or hypertension? Hypertension. What is atherosclerosis? Plaque that build up in the arteries, inflammation of the heart, or valve rupture? Plaque buildup in the arteries. What is an angioplasty? Widening of a blocked artery, valve surgery, or clot removal? Widening of a blocked artery. What is the network of small vessels that connect arteries and veins called? Medium veins, arterioles, or capillaries? Capillaries. Which part of the heart receives blood rich in oxygen? Left side, right side, or both sides? Left side. Which part of the heart pumps blood to the lungs? Left ventricle, right ventricle, or left atrium? Right ventricle. What is the main function of red blood cells? Fight infections, clotting, or carry oxygen? Carry oxygen. What is essential for heart muscle contraction? Calcium, potassium, or sodium? Calcium. Which blood type is known as the universal donor? AB positive, O negative, or A positive? O negative. Which blood vessel carries oxygenated blood from the lungs to the heart? Pulmonary vein, aorta, or superior vena cava? Pulmonary vein. What do white blood cells do? Transport oxygen, help in blood clotting, or defend against infections? Defend against infections. Which part of the heart has the thickest muscle wall? Left atrium, left ventricle, or right ventricle? Left ventricle. What happens to the heart during diastole? Relaxes and fills with blood, contracts, or the valves close? The heart relaxes and fills with blood. Which part of the heart receives blood from the body? Right atrium, left atrium, or right ventricle? Right atrium. What is the liquid part of blood called? Serum, hemoglobin, O plasma. Plasma. Which component of blood carries oxygen? Hemoglobin, white blood cells, or plasma? Hemoglobin. Which valve separates the right atrium from the right ventricle? Mitral valve, tricuspid valve, or bicuspid valve? Tricuspid valve. What is a common symptom of a heart attack? Fever, blurred speech, or shortness of breath? Shortness of breath, sometimes even without chest pain, especially in women. What is the main risk factor for heart disease? Low blood pressure, high cholesterol, or low iron levels? High cholesterol. Now the most challenging question, where does the electrical impulse that makes the heart contract initially originate? Is it in the atrioventricular node, Purkinje fibers, or sinoatrial node? Sinoatrial node.